It's an appetite stimulant. So guess what, Mary Lee? When the food industry figured this out, you think they told anybody? That they found that a new form of the gliadin protein was a potent appetite stimulant. This occurred even though it was invented in the 60s and 70s. It finally made it to most store shelves about 1980s, mid 1980s, which coincides, doesn't prove cause and effect, but it coincides with the explosion in obesity, food consumption, and all the problems that we now know are everywhere. We've exported it all around the world: type 2 diabetes, autoimmune diseases, dementia, all that stuff. Not to say all those conditions are caused by this new form of wheat, but it's a big part of the problem.
Welcome to the Menopause Disruptor Podcast, the podcast that cuts through the noise, busts the myths, and delivers straight talk and truth about your hormones, your body, your health, and the power that you have in midlife and beyond. And I am your host, Mary. If this is your first time to the show, welcome. So glad to have you here today. My guest today, well, I had it in my mind that we're going to take the conversation one direction. He took it in a completely other direction, still related, but oh boy, it's an eye-opener. Dr. William Davis, the famous author of Wheat Belly. He's not only the trailblazing cardiologist who brought us that game-changing book, but he's also been leading the charge on understanding how modern wheat is hijacking our gut health, disrupting our hormones, and making it nearly impossible for women to lose weight, feel energized, and feel like themselves again. What he has to share on this episode will shine the light on issues that not just in the menopausal years, but in our reproductive health, and what not only modern day wheat, but the use of antibiotics and a poor North American diet has been doing to our reproductive health. We're talking miscarriage, premature delivery, difficulty getting pregnant, endometriosis, PCOS, the list goes on. In this conversation, we're going deep, not only into the belly, literally and figuratively. We are also going to talk about the microbiome that exists in all systems of the body, in particular, the vaginal microbiome. And Dr. William Davis will explain to us the power of human microbes that can help restore our health, in particular, fermented human microbes. And where do we get them from? The human body. He will explain how. And you can't talk about microbes without addressing SIBO, small intestinal bacterial overgrowth, which is a condition where abnormally high numbers of bacteria grow in the small intestines, where they're not supposed to live. And SIBO bacteria from the colon can proliferate in the small intestines, disrupting digestion and nutrient absorption, as well as a whole host of issues, including chronic inflammation. Dr. Davis will also address supplements that we need to take because we are very low in the North American diet. And we'll also talk about the skin microbiome. Yes, there is a skin microbiome, like every other system in the body. And our skin health also has a vital role in immune function and overall well-being. So whether you're tuning into this episode because something caught your attention about the weight gain in midlife, or you're complaining about shift and changes in your skin appearance, or the classic menopause symptoms such as inflammation, tiredness, and cognitive function, I'm here to tell you that they're all related, and Dr. Davis will explore them even deeper, but he will also provide profound solutions to address all these problems. You're going to want to stick around. So grab yourself a cup of tea or put on your walking shoes or your favorite cozy slippers. Settle in because this episode is one you will not want to miss. And probably an episode that you want to jot down a few notes, but don't worry, we'll have that all in the show notes. Please join me in welcoming Dr. William Davis. Dr. William Davis, author of Wheat Belly and several other books, which we'll talk about. Welcome to the Menopause Disruptor Podcast.
Thank you, Mary Lee. Glad to be here. So much to talk about.
So much to talk about. Oh my goodness. So for the listeners who may not be familiar with your work, just bring us right back to the wheat belly and tell us what has happened to the modern wheat and why we really need to start paying attention.
Well, this all came from my efforts to give people better tools to control heart disease, of all things. By heart disease, of course, I mean coronary heart disease, heart attack, sudden cardiac death, all the stuff that makes oodles of money for the healthcare system and is addressed by such silliness as reducing cholesterol and saturated fat, which, by the way, has no effect whatsoever. That's a misinterpretation of outdated data. But
Mm.
anyway, but when you have people whose disease is rapidly progressing, you want to stop it. And we did help publish these data. If you have people with these are people, Mary Lee, who survived sudden cardiac death, who had 3 stents for a heart attack, who had bypass surgery, and they are desperate for solutions. Well, the solution, this now I'm talking about 25, 30 years ago. The
Hmm.
solutions back then were largely a baby aspirin, a statin cholesterol drug at high dose, exercise program, maybe some other things, beta blockers, other drugs. Well, we
Right.
have helped publish these data. They do not work. The disease
Oh.
progresses rapidly. Once the disease is established, Mary, it progresses very rapidly, and it's terrifying. When you see this disease galloping forward at about 25% per year on the
Mhm.
best treatment they had in conventional medicine, you realize that the conventional solutions are not solutions at all. So I started looking for better solutions. Well, one of the solutions comes from rejecting cholesterol testing, this awfully outdated method of trying to identify risk factors for coronary disease. Well, that came from a very flawed and outdated body of science. There are many things you can look at to prevent heart disease, but one of them is lipoprotein testing, fat carrying particles in the bloodstream. That cholesterol testing was meant to guesstimate or kind of estimate what the particles were doing. So we can actually measure the particles. I've been doing it for over 30 years. And you learn rapidly that the causation of heart disease has nothing to do with fat or saturated fat. And this science came from places like University of California, Berkeley, Johns Hopkins, University of Toronto, Texas. Very well sorted out science, Mary Lee, that it's wheat grains and sugars that contain the amylopectin A, that's the carbohydrate wheat and grains, and then sugars like sucrose, glucose, fructose that provokes formation of small LDL particles. So because my patients back then, my large cardiology practice, were desperate for better answers, I said, let's give it a try. Let's use this new science. Let's eliminate all wheat, grains, and sugars. They did. And by tracking NMR, nuclear magnetic resonance lipoprotein, it sounds awful. It's very easy. It's cheap. It's available. The doctor won't tell you that. If Mary Lee goes to her doctor and says, hey, doc,
Right.
I think I'd like an NMR lipoprotein test. He's going to say, nope, we don't pay for that. It's research. We don't do it. These are all lies. These are bald lies. I've been doing it for 30 years. I can't say whether the Canadian system pays for it, but in the US, it's widely paid for, even by Medicare. And even if it
Okay.
did, it's $100.
Yeah.
Uh,
Yeah.
well, so I had people eliminate wheat grains and sugars, and small LDL particle measurements would drop from some high value, like 2,000 nanomoles per liter, particle count per volume, to zero or some other low number. But then I saw many other aspects of their health improve dramatically. People would say, I lost 8 inches off my waist. I had to stop
Wow.
3 blood pressure medications I was on because I was too lightheaded. I had to stop the metformin and the glyburide for my blood sugars because my blood
Wow.
sugars were too low. I saw health improve dramatically just with that maneuver. Now, there was more to it. I did restore some nutrients largely lacking in modern life. You and I live at latitudes where it's hard to get vitamin D. So we restore
Hmm.
vitamin D. By necessity, we have to filter our drinking water. That means we don't get magnesium from drinking water. We don't eat wild plants rich in magnesium. So we address some common nutrient deficiencies also. And people had extraordinary successes in their health
Beautiful.
by doing the opposite of what dietary guidelines told us. But it also became clear that we had to address the microbiome. And what's great, Mary Lee, in the last decade or so, it's not just the gastrointestinal microbiome, it's the oral microbiome, skin, vagina,
True.
bladder. Every location of the body has a unique signature of a microbiome, and yet we have disrupted all of them because of our overexposure to antibiotics. In the US, there's about 700 prescriptions for antibiotics written every year per 1,000 adults, likewise for children. So we've massively disrupted the gastrointestinal, and that's just from antibiotics. There's other factors, of course, glyphosate,
Hmm.
herbicides, pesticides, food additives. All these things disrupt the microbiome. So it became clear we had to address the microbiome. That opened up a whole new universe of things to
Yes.
do, especially relevant to reproductive and menopausal health in females. I have a daughter-in-law who's going to deliver her third child in about 2 months. And this is a woman who's got a gynecologist, an obstetrician, an endocrinologist, a gastroenterologist, a rheumatologist, a functional medicine doctor, a primary care doctor. This is a woman, and yet no one said a word about my son says to the obstetrician, just testing her, says, "Hey, doc, is there any role for probiotics in pregnancy?" And she says, "Oh, no, they've been disproven." The exact opposite is true. It's critical that a woman is aware of microbiome issues, both in pregnancy and menopausal years, as well as all the years in between, also, because they
Of
play
course.
major roles in all the aspects of a woman's health
Oh my
and the
goodness.
baby's health, also.
Hmm. Just why have we disrupted the ancient wheat for modern day consumption? What happened there?
Marilee, everything we talk about boils down to money.
Ugh,
What pays best? So with wheat, it didn't start out as being a money issue. It started out as a noble issue to help feed the world's hungry. How to increase yield per acre to feed the people in the Sudan, in Somalia, in
mhm.
Calcutta, all that. And so efforts were made to introduce marked genetic changes into the wheat plant to increase yield per acre. And they succeeded. It took many years. This is all in the 1960s and 70s. They increased yield per acre about 4 to 8 fold, and it was a great success. It led to the Nobel Peace Prize for one of the scientists who figured out how to increase the yield by generating what's called high yield semi dwarf wheat. Likewise, why, like with my daughter-in-law, why is nobody telling her about all the fantastic things she can do in the microbiome during pregnancy? Why is no? Because if it was $1,000 or $5,000 biologic drug, they would tell her about it. But if it's
Mhm.
something you can do in the comfort of your kitchen for very little cost, no one cares. And so it's
Exactly.
merely over and over and over, it boils down to money and profit.
Unbelievable. And so is this why, because I went back and I went through the Wheat Belly book again, the protein structure, right away you talk about the protein structure. 95% is still fairly the same, but there's that 5%, that new molecule that has not been tested. Now, with all the problems and the rise of celiac disease, which you say is about what 400%, most of it in the last 2 decades, we're seeing an increased rise. Why isn't the FDA? Why are we not doing any testing on just what exactly is this new molecule?
So it's just a shift in the amino acids composition of the gliadin protein. People say gluten, but a more specific term would be gliadin. It's the protein within gluten that is the source of most
Okay.
troubles. And the efforts to increase yield per acre caused a shift in a few amino acids, but that's all it takes to generate differing effects on humans. And one of the effects is that this new form of gliadin. So, one of the problems with wheat consumption is that humans don't have the enzymes to break down the proteins in wheat to
Oh,
single amino acids. So, if you eat an egg, for instance, your enzymes will break that down, those egg proteins down to single amino acids. And then your body in turn uses those single amino acids to make skin, brain, and joints. When you eat the gliadin protein of wheat, especially modern gliadin forms, you can't break it down into single amino acids. The best you can do is break it down into 4 or 5 amino acid long peptides or fragments.
okay.
Well, these are very unique. And these peptide fragments of 4 and 5 amino acid long lengths penetrate the brain and bind to the opioid receptors and stimulate appetite and have other psychological, mental, and emotional effects in people who are susceptible. So, people, for instance, who are prone to binge eating or bulimia will have 24-hour a day food obsessions. Children with ADHD or autism will have behavioral outbursts and abbreviation of their attention span. People who are prone to depression or suicide will have amplification of depression or suicidal thoughts. People
Oh,
prone to paranoid schizophrenia will have triggering of auditory hallucinations, hearing voices, or worsen paranoia. Uh, in us who don't have those conditions, it's an appetite stimulant. So guess what? When the food industry figured this out, you think they told anybody that they found that a new form of the gliadin protein was a potent appetite stimulant? This occurred even though it was invented in the 60s and 70s. It finally made it to most store shelves about 1980s, mid 1980s, which coincides, doesn't prove cause and effect, but it coincides with the explosion in obesity, food consumption, and all the problems that we now know are everywhere. We've exported it all around the world: type 2 diabetes, autoimmune diseases, dementia, all that stuff. Not to say all those conditions are caused by this new form of wheat, but it's a big part of the problem.
and oddly enough, it coincides with big tobacco being called out and the people like Nabisco buying all of these cereal companies, which is laden with wheat. The sugar corn
That's
pops, the Fruit Loops, it's all wheat based as well.
food,
Yeah.
big food and tobacco are one and the same.
Unbelievable. I am particularly interested in the women's health, though. We are seeing problems with sleep, weight gain, that excess around the midline. We're seeing issues with the gut microbiome, issues with bone density loss. Just exactly how does wheat play into those factors or contributing to increasing menopausal symptoms that women are being plagued with?
Well, a variety of ways, but the biggest way is inflammation. So the
Ah,
amylopectin A, that's the carbohydrate unique to wheat and related grains. Grains are all related to each other. They're very promiscuous genetically.
mm.
And so the carbohydrate unique to grains, amylopectin A, raises blood glucose more than table sugar. It's a very potent carbohydrate. So while many proteins in wheat are indigestible, the carbohydrate of wheat and grains is very highly digestible. So that amylopectin A raises blood glucose to very high levels. That glycates or glucose modifies multiple proteins in the body, which disables and accelerates aging. It also causes expansion of abdominal visceral fat, which is inflammatory and leads to insulin resistance, which is a vicious cycle. Insulin resistance, abdominal fat expansion, more inflammation, more inflammation, more abdominal fat, and more insulin resistance. So consumption of modern wheat is a perfect storm for getting inflamed and insulin resistant. Now, we don't know how much we can blame wheat consumption for disruptions of the gastrointestinal or vaginal microbiome. Those are issues that may be to some degree separate. There's some overlap, but there's not enough science to tell us just how much of a role there is. So here we're getting into issues like antibiotics, things that ladies do for vaginal health. And one of the lost microbes that's very important for female reproductive health is Lactobacillus reuteri. So
Okay.
this is a microbe that all wild mammals have. Deer, elk, wild boar, they
Wow.
all have Lactobacillus reuteri. All human gatherer populations unexposed to antibiotics and other factors, they all have reuteri. The Yanomami of the Brazilian rainforest, the natives of the jungles of New Guinea, they all have Lactobacillus reuteri. And modern people in North America, almost all of us have lost it because it's very susceptible to common antibiotics. What does reuteri do? Well, it does a number of things. One of the things it does when it's in the GI tract, it sends a signal to the brain to release the hormone oxytocin,
Ah.
the hormone of uterine contraction. So it facilitates
Oh.
childbirth. It also, when a mom is trying to breastfeed, it facilitates expression of breast milk. So all these ladies who
Oh.
can't breastfeed, a big part of the reason is the loss of reuteri and the loss of contractile function in the little muscles of the breast tissue. When a mom lacks reuteri, it's harder to bond with her baby. The maternal infant bond is less strong because of the loss of oxytocin, and she's more likely to suffer postpartum depression.
Wow.
So lactobacillus, that's one microbe, Marilee. That's one microbe. How about Lactobacillus crispatus? Another microbe. lost by about a third or so of modern females because it's also a lactobacillus species like rhodori, very susceptible to common antibiotics. So the amoxicillin you took 20 years ago, say, for an
Right.
upper respiratory infection or a urinary, whatever, tract infection, it wiped out all your lactobacillus rhodori and it likely reduced or eliminated your lactobacillus crispatus. Why is that important? So lactobacillus crispatus is meant to be the dominant microbe in the human vagina. If a
Okay.
woman lacks it, she's much more likely to miscarry. She's more
Okay.
likely to have premature delivery of a child. You know that's catastrophic. If a woman delivers at 28 weeks, that child is impaired for a lifetime, sometimes doesn't even survive. So it delays delivery more towards term. It discourages infections like E. coli or Candida infections. And here's something, this is wonderful, new science. Actually, a lot of it came from a university right near here, Loyola. I'm in suburban Chicago. They
Hmm.
did very elegant work to show that the vaginal microbiome is the source of the bladder or urinary microbiome.
Wow.
So, isn't that amazing? A woman, for instance, can take oral lactobacillus crispatus. It will colonize the gastrointestinal tract, which in turn colonizes the vagina, which in turn colonized the bladder. Now, wait a
Bladder.
minute here, Mary Lee. There's no connection that anybody knows about. The gastrointestinal tract doesn't have any kind of connection to the vagina or the bladder. How does it get there? Well, nobody knows for a fact, but it's probably what's called translocation in the perineum, the groin, and by contiguity, by nearness. And by the way, that lactobacillus crispatus is probably one of the most important skin microbes. So now there's talk
Wow.
of a vagina skin axis. If a woman restores crispatus, it colonizes the vagina, makes it less likely to have discharge, infections, E. coli, other forms of vaginitis like Candida. She's less likely to have repeated bladder infections. She's less likely to suffer incontinence, sneezing, laughing, and wetting herself. These are
It's
these are
interesting.
major problems in women,
Interesting.
especially as they age. And as a woman ages, especially in her 60s and onwards, vaginal atrophy, dryness,
Yes.
irritation, pain becomes almost universal. Well, guess
Yes.
what? Crispatus restores normal vaginal moisture and sensation. And even better, if you couple it with rhodori, rhodori restores youthful libido. I
Wow.
cringe, Mary Lee, to hear what conventional solutions there are. A woman has vaginal atrophy. The doctor says, we're going to put you on estrogen. Or a woman says, hey, I'm tired age and I want to travel, have fun. And part of that is satisfying my partner. Well, what's the conventional solution to loss of libido? Well, maybe progesterone a little bit. And there are two drugs. And the drugs are awful. For instance,
Mm.
one drug is flibanserin. It's an injectable drug. It's about $400 per dose.
Oof.
And a woman has to anticipate sexual activity by 40 minutes, which who can do that, right? Inject herself into her thigh, and yet
Yeah.
it has almost no effect. They're so ineffective that the FDA is contemplating retracting their withdrawal.
Good.
So here we have merely two microbes. There are more, but those two are the two dominant microbes that have major influences: reproductive health, menopausal health, and all the years in between.
Fantastic.
One of the problems with probiotic preparations is that they tend to sell you these things at very low counts of microbes because microbes are very costly to produce. So one
Right.
of the things I do is I ferment them. And that's a
Okay.
way to increase microbial counts several hundred to 1,000-fold.
Okay.
So, for instance, you can get a source of, let's say, Lactobacillus crispatus, ferment it, and you can increase it to very high numbers. Likewise, rhodori. Source it, ferment it, increase the counts several hundred to 1,000-fold. You get bigger effects. There's a little bit of hassle. We call it, for instance, L. rhodori yogurt, and the crispatus we call it vagina yogurt because it's a vaginal microbe. It's very easy to do. I was in a beer brewing store recently, and I'm talking to the guys because I needed some equipment. One of the things we do is we make fermented juices to reduce sugar and get microbes. And so I sometimes go to these beer brewing stores to get equipment like venting caps. It releases the gas. So
Okay.
I'm talking to these guys, and they asked me, well, what are you fermenting? And I said, well, human microbes. They're horrified. It's such a foreign concept that we can ferment human microbes to obtain specific effects. Now, it doesn't stop at Reuteri and Crispatus. There are other microbes, but those two are the ones that have the greatest relevance to female reproductive and menopausal health.
So when it comes to eating good macros and like real food sources, can we get our probiotics through eating fermented foods, which we say are really rich in probiotics and prebiotics?
So the microbes in fermented foods are wonderful. These are microbes that are unique to plants, like
Ah,
Leuconostoc mesenteroides, Pediococcus penthesaceus, Pediococcus acidilactici, Weisella species. And so while those microbes are very helpful, they typically don't colonize the human body. They do provide great benefits. So getting sauerkraut and kimchi and kefirs,
okay.
those are all wonderful. But
Okay.
that's where I point out what we're talking about is fermenting human microbes. And human microbes come from humans.
Oh,
So they have to be
okay.
isolated initially from breast milk, say, or a woman's vagina or stool. And then we isolate that microbe, we proliferate it. Now we've proliferated further because you and I don't want to pay
Yeah.
$300 for a probiotic because that's what it would cost. We're going to
Right.
make yogurt out of it. It could be L. reuteri yogurt, could be Crispatus yogurt, vagina yogurt. So it's a way to get very high microbial counts, really, at very little cost. And you know what? Vagina yogurt, surprisingly, is the most tasty yogurt you ever had. It
Okay,
tastes
wait,
like
wait,
thick
wait.
whipped cream.
Okay. How do we get this yogurt, or how do we source this?
I can't mention where to get the microbes.
I totally get it. And we shared this similar sentiment because it was Susan Bratton, thank you to her, who put me
Oh,
on to
that's right.
introducing me to you. And she talked about the yogurt and how we can cultivate it ourselves. And it's so wonderful. And then she said, I have to introduce you to Wheat Belly Bill, Dr. William Davis. So that's what got us onto it.
Making a yogurt is really stupid simple because you don't want to pay for probiotics over and over and over again. And you get bigger effects, especially if you have
Yeah.
C. We haven't talked about that. Yeah, you familiar with that issue?
Well, let's talk about it then. Take it
Okay.
away.
So another issue that enters into the picture, not just for reproductive and menopausal health, but for everyone's overall health, but it does affect a woman's health. So if a woman has overgrowth of fecal microbes,
Okay.
fecal microbes are supposed to be in the colon. Colon is
Ye-
pretty well equipped to deal with that. Not
Yeah,
always. It can lead to ulcerative colitis and colon cancer and diverticular disease, but in general, the colon is better equipped to handle trillions of fecal microbes. But half the North American population, merely half the North American population, perhaps more,
that's huge.
because of overexposure to antibiotics and all those other things like glyphosate, herbicides, pesticides, chlorinated drinking water, preservatives in food, etc., has allowed the overproliferation of fecal microbes that have now ascended into the 24 feet of small intestine. The small intestine is very permeable by design. That's where you absorb amino acids and vitamins and minerals and fatty acids. But when you have the colonization of the 24 feet of small intestine by fecal microbes, the small intestine is not well equipped to deal with that. It's very penetrable, very thin mucus layer. So trillions of fecal microbes living where they don't belong inflame the intestinal wall, making it very even more permeable. When they
Yeah.
die, microbes only live for a few hours. When they die, they release their toxic components into the intestines that then gain entry into the bloodstream. That's called endotoxemia. What can that do to a woman? It can cause premature labor. It can cause relaxation of the cervix. It can cause obesity, expansion of abdominal fat, higher blood pressure, hormonal disruptions. It's a risk factor for breast cancer and other cancers. It's a risk factor for Alzheimer's dementia, coronary disease, atrial fibrillation, rosacea, psoriasis. In other words, it's a phenomenon. This SIBO and the accompanying endotoxemia is a risk factor for virtually all common chronic diseases. Not injury, not infection, but all the diseases we become all too familiar with, the diabetes, coronary disease, dementia, cancers, all the autoimmune diseases, neurodegenerative disorders. Uh, Not to say that SIBO and endotoxin causes all of them, but they either initiate or make worse all those conditions. And so unless you take control of that, you can't take control of your health. Yeah, you can take a GLP-1 agonist and lose weight, but if you didn't address the SIBO and endotoxemia, you're going to regain the weight and be more hypertensive, be greater risk heart disease, breast cancer. So, the way we've been doing it, merely, is restoring that one microbe mentioned earlier, Lactobacillus rhodori, with another microbe, Lactobacillus gasseri. Those two are very good at colonizing the small intestine. And they produce what are called bacteriocins, natural antibiotics that kill fecal microbes. Now, I've lately added a third. It's called Bacillus subtilis. And we ferment it as a yogurt. I call it SIBO yogurt. We ferment for 36 hours, so much more than the commercial yogurt of 6 to 12 hours. So we're fermenting unique microbes with those characteristics. And then we consume a half cup per day. And so far, been about 90% effective in eradicating SIBO. Now, there's a little bonus in here, Lactobacillus gasseri. So we've talked about, for female health, Lactobacillus rhodori. We talked about the dominant vaginal microbe. But Lactobacillus gasseri is also very important for vaginal health. It's probably number 2 among the most important microbes in the vaginal microbiome. And it's known to reduce the symptoms of menopause.
Oh,
Women who have the so-called vasoactive symptoms like hot flashes, Lactobacillus gasseri reduces hot flashes. It can also reduce some of the intensity of the symptoms associated with menstrual cycles. So gasseri, yet another microbe reduced in most modern ladies, we restore it. And rhodori gasseri, Bacillus subtilis, you can use that as SIBO yogurt to reduce endotoxemia, but it also happens to do all these other things. Now, the only warning here, Marilee, is I don't know how safe these big numbers we get by making are how safe it is in pregnant ladies.
right.
Because of the risk for uterine contraction. So if a woman is pregnant, I wouldn't do the yogurts like that. Well, but it's clear everybody should have rhodori. So one thing a woman can do is, if she wants the rhodori, but not the super duper high counts. By the way, when we count the number of microbes, when we ferment rhodori by itself, we get 300 billion with a B, per 120 milliliter serving. So if a pregnant woman wants to do this, because all women should have it, what we do is we co-ferment with other microbes. And an easy workaround, get the rhodori, get some conventional yogurt. Make sure it's made with live cultures. It'll say our yogurt's made with Lactobacillus acidophilus, Lactobacillus bulgarius, Streptococcus thermophilus, Lactococcus lactis, whatever. Take some of that yogurt, couple tablespoons, ferment it with the rhodori. So it's like your backyard garden.
Oh, yeah.
Springtime. Marilee has a 10 by 10 plot in her backyard. If all she does is plant tomatoes, you're going to have a ton of tomatoes at the end of the growing season. What if you plant tomatoes and zucchini and squash and rhubarb? How many tomatoes are you going to have? Much fewer. So the same principle. So a woman doesn't get overloaded with rhodori and thereby risk premature labor.
So balance, yeah. You know, I'm really interested what you have to say about its impact on our reproductive health, our menopausal health. As you mentioned, miscarrying, premature delivery, delayed delivery. How much of the antibiotics have been playing out, and of course, the wheat diet, overconsumption of wheat, how is that playing out into endometriosis and PCOS? Very common health concerns for women, young women.
Excellent idea. Yeah. So endometriosis is over time looking like a disease of wheat consumption, the gliadin protein of wheat, combined with SIBO, small intestinal
Okay.
bacterial overgrowth, and endotoxemia. So, and because, as you know, the conventional solutions for endometriosis are horrible.
Yes.
Repeated surgical resection. I've met women who had 7, 8, or more laparotomies looking for those endometrial implants. They're terrible. And there's some hormonal solutions. They're not solutions, of course. And so if wheat and grain elimination combined with addressing SIBO can have a beneficial effect. But you can see, you and I and your listeners can do this for almost no cost. If I said, well, it's going to cost you and your listeners $5,000 each to do this, guess what? My colleagues get in line to do it for you. But if it's something you do in the comfort of your kitchen for little to no cost, then there's no interest in the medical system. I mean, it's really bad, of course, in the US, where it's so disgustingly profit driven. It's only
Mm.
about money, it has nothing to do with
Yeah.
your health. And
Yeah.
so this is stuff people have to do on their own. But endometriosis is looking like a disease, both of the gliadin protein of wheat and of SIBO/endotoxemia.
Unbelievable.
PCOS, also the 15% of ladies who are prone to PCOS, it's brought out by, as you would predict, wheat and grain consumption and sugar consumption that causes expansion of abdominal fat. So just addressing diet, no wheat, no grains, no sugar,
Okay.
addressing common nutrient deficiencies that amplify insulin resistance, which is a big factor in PCOS. So we address vitamin D, magnesium, omega-3 fatty acids, and iodine. And then we
Okay.
address the microbiome. And I've got oodles of ladies who've had PCOS for years. Some even had in vitro fertilization, and they're now pregnant, not with in vitro fertilization, but with the usual way. And they're no longer type 2 diabetics or pre-diabetics. They're no longer hypertensive. They don't have that excessive hair. They're just back to normal. So it's very easy, but it's almost free. And so the gynecology and primary care community don't care to talk much about this.
Well, and I pretty much know the answer to this next question. I was going to say, if Dr. William Davis was to redesign women's health, starting all over again, what would be the core essence of the healthcare system for women?
Reproductive health and menopause health are big topics, but it's even
Yes.
bigger. It's childhood health, it's male health, it's all aspects of health. So a lot of the problem here is the nature of medical education and training. It's too profit driven. It's driven by the pharmaceutical industry, the medical device industry, the healthcare industry, and the outsized profits for people, for healthcare insiders. And so you've heard all this. I'm sure your listeners have also. That, for instance, education for physicians in nutrition is deplorable. And that's
Yeah.
why you have them saying stupid things like probiotics don't work, you're making expensive urine, all
Yeah.
those kinds of silly things they say. When the
Yeah.
truth
Women
is,
should be on SSRIs. Yeah, exactly.
Mhm.
Yeah. Mm-hmm.
The truth is, when somebody understands nutrition, the microbiome, you have profound control over all, including pregnancy, post delivery. Another microbe I should mention before we close out is Bifidobacter infantis. So, this is a microbe that mom is supposed to have, and she's supposed to convey it to her child as the child passes the birth canal and at breastfeeding and with contact, because that microbe is essential. So Bifidobacter infantis is critical because when mom breastfeeds, the child can only digest human milk oligosaccharides if that child has Bifidobacter infantis. So the infant's microbiome is very different than an adult. The child's microbiome is dominated by Bifidobacter infantis, and it allows it to consume and metabolize those human milk oligosaccharides in breast milk, and that allows proper neurological maturation. And the child will have a higher IQ, less prone to asthma, less prone to autoimmune diseases like type 1 diabetes, less likely to have obesity and a type 2 diabetes as an adolescent. So the problem is women get antibiotics during pregnancy or even pre-pregnancy and during delivery and post-delivery. The child often gets antibiotics for things like group B streptococcus. So in many instances, the infantis, Bifidobacter infantis, is wiped out, and the child does not get that microbe. So even if that child breastfeeds, does not obtain all the benefits of breastfeeding. So we restore Bifidobacter infantis. Now, there's a company that's done a pretty good job of validating all this. It's called Avivo, EVIVO, in California, in Sacramento, California. Now, I have no relationship with the company. They have a product. It's very costly, though. So what I tell ladies is it's $89 for a little vial. What I tell them is buy the vial, swallow the 89 bucks. I'm sorry they do that. Make yogurt out of it. And then you consume it as a pregnant mom, and then that way you pass the microbe on to your child at delivery and with breastfeeding. And use maybe an abbreviated fermentation. So it takes the entire bottle, we ferment most of our microbes at about 100 degrees Fahrenheit, 37 degrees Celsius, human body temperature. And we
Right.
usually do it for 36 hours, but in pregnancy, probably abbreviate it to maybe no more than 24 hours. And mom
Cool.
consumes it. She populates her vaginal canal and her breast milk and her GI tract
Clever.
with Bifidobacterium infantis. She passes it on to the child. Child now has it, and the child can metabolize human milk oligosaccharides.
Interesting. That is just fascinating. Fascinating. We could talk at great length about autoimmune disease and its link to neurodivergent traits, ADHD. I'm sure that there's still more links there to be explored. We have just scraped the surface, but Dr. Davis, what you shared with us is profound. I will share all those links in the show notes. We started our conversation on the Wheat Belly book, but I do see behind you a couple other books, Super Gut and Super Body. Maybe you mention those briefly to our listeners, and we'll get all those links in the show notes.
Sure, Marilee. So the Super Gut is my kind of the book that tells you how to do all these things.
Perfect.
The Bifidobacterium infantis, I don't think is in there because that's kind of a new thing, but it shows you how to make the rotary yogurt, the
Beautiful.
SIBO yogurt, the principles behind all this, the where the science comes from. So that's a Super Gut book. Where to source the microbes, how to ferment them, what kind of devices you might need, like a sous vide or a yogurt maker or an instant pot. The
Okay.
Super Body book won't come out till this December or January. And that came from a small clinical trial I performed where we took 25. One of the odd things, Marilee, is I talked to a lot of ladies. Most of my audience is female. And they say things like with the rotary, for instance, they say, we don't really care about the restoration of youthful muscle, one of the effects. We don't really care that much about the return of libido and better immune response. Nah. And all the oxytocin effects like increased intensity of love and affection, increased
Yeah.
generosity, acceptance of other people's opinions. And they said this to me many times. We just want better skin. And I said, what? Okay, fine. So I did a small clinical trial, skin trial, and
Okay.
had ladies restore the rotary and some other components that are good for skin. And over 90 days, they lost their skin wrinkles. They were real happy, increased skin moisture, but we happened to measure waist circumference because it's free. And they lost up to 21 centimeters off their waist circumference with no change in diet or exercise.
That's impressive.
First, Marilee, I didn't believe it at first. I thought there's no way. But we found a way, I believe, and this is preliminary, target abdominal fat. And the ladies didn't lose weight. They lost up to 21 centimeters plus off their waist, but didn't lose weight. Why would that be? Well, consistent with the animal experimental, yes, and with my very large anecdotal experience, increased muscle. I personally gained 13 pounds of muscle and my strength increased by 51%. This is some years back when I was in my early 60s.
Oh,
So it's become clear we found a way to modify what I call shape and body composition, redistribute where fat is located, restore youthful musculature. And that's the basis for the Super Body book. That won't come out for another,
I can't wait
8
till it
months or
comes
so.
out.
I wrote it a
I'll be
while
pushing.
back, but that's the nature of the publishing industry.
I'll be pushing it, and we'll have the listeners circle back come this winter. Wow. I'm really big on pushing muscle. That is the premise of my
Oh, good
coaching
for you.
program too, is menopause strength.
Yes.
I'm a student of the Dr. Stacy Sims Next Level and Menopause 2.0. And it really speaks to what we eat, what we put in our body, and how we treat our bodies. And you have just upped the ante and given us a whole set of new tools to think about. So we'll share that book, The Super Gut, in the show notes, as well as your website, where people could start to learn about becoming their own alchemist of their bodies, create their own cultures. That's so wonderful. Dr. Davis, I am thrilled. Again, a big shout out to Susan Bratton for linking us, putting us in contact with each other, and you sharing your profound knowledge on women's health in general, but what you're doing in women's health. This is beautiful. Thank you so much.
Thank you, Marilee. Keep up your great work. What
a crazy, fascinating conversation with Wheat Belly Bill, Dr. William Davis, cardiologist, New York Times bestselling author of Wheat Belly and Super Gut, with another book coming out in the winter 2025. And he is the founder of Infinite Health, which is linked in the show notes. You can find him at drdavisinfinitehealth.com. He shared some pretty fascinating stuff with us. Vagina yogurt. Yes, you heard it right. Vagina yogurt. Well, by FDA standards, you really can't call it yogurt. So instead, it's vaginal fermented dairy, fermented with human microbe Lactobacillus crispatus, which he explains is an important inhabitant of the normal human vaginal area, but has been lost due to antibiotic exposure, for example, and a critical microbe that plays an essential role during important milestones in a woman's life, her reproductive years, and menopause, as well as all the years before, after, and in between. But that's not the only fascinating key takeaway from this episode. Like I said before, I thought we would get into more of the wheat belly and talk about the modern wheat and problems that have surfaced as a result of the genetic changes to wheat, leading to conditions such as PCOS, endometriosis, as well as menopause symptoms. But it truly was understanding the microbiome, whether it's in our gut, our vagina, or in our skin. When we can restore microbes like Lactobacillus reuteri and crispatus, we are making a real difference in overall health. And he unpacks so much of this in his book, Super Gut, which in summary is a 4-week plan to eliminate harmful bacteria and restore the beneficial microbes in our microbiome. Dr. Davis emphasizes that many health conditions that are rooted in microbiome imbalances are reversible, often with simple lifestyle changes. And the book equips readers with specific techniques and recipes to reclaim their health, their vigor, and their youthfulness. Those aren't my words. Those are the words of Dr. Mark Hyman, probably the world's most trusted functional medicine doctor. But like menopause in general, what I really loved most about this conversation with Dr. Davis is that he teaches us that we have the power to make impactful changes in our health through simple, mindful choices. You want better sleep, you want to tackle weight gain and inflammation. It's all interconnected with diet, with lifestyle, and of course, the microbiome health, which too often is overlooked, as he says, due to a profit-driven healthcare system. Go check out those books. They're linked in the show notes. If today's insights resonated with you, I'd love for you to be a part of our growing community of menopause disruptors. Hit that subscribe button wherever you're listening right now. And if you know someone who can benefit from these conversations, please share this episode. Sometimes a simple act of sharing can be the first step in someone's healing journey. And hey, if you're ready to take the next step in your menopause journey, I'm here to support you. You can find all my services, including my comprehensive menopause intelligence digital course, one-on-one coaching programs, and workplace education services at mlcoaching.com. It's in the show notes. Want to stay connected and get regular doses of menopause wisdom? Follow me on Instagram at Menopause Disruptor Podcast, where I share tips, insights, and real conversations about navigating this transformative phase of life. Let's continue to disrupt this menopause conversation together. Remember, midlife should be the best life, and it will be. Namaste.